Hello, good afternoon. It's Dr. Chudi Ufondo of Snowspirations Global Health Solutions. How are you faring? Today is the first Saturday of November 2022. And on this very good day, we're going to talk about hypertension. How can we prevent development of full-blown hypertension from prehypertension? So people don't just develop hypertension. Before they become hypertensive, they would have started from a place we call pre-hypertension. So it's more like going into the university. So the entrance exams you take to get into the university. So what I intend to do today is to give you 5 important practical tips you can apply so you can avoid development of full-blown hypertension. So from pre-hypertension to avoiding real hypertension. Now, hypertension is a very, very deadly disease. Hypertension is also known as high blood pressure. It's very common. Some of them might be in your family. So if you have a mother, if you have a father, if you have a sister, if you have a brother who is hypertensive, then you have a risk factor. So any member of your family that has hypertension puts you in hypertensive risk factor. So you should be very conversant with this. If your dad died of hypertension complications, if your mom is currently living with hypertension, possibility it's very high you might have hypertension. Unfortunately, so many people don't even know if they are hypertensive or not because they don't go for checks. There are some people that their blood pressure is so high, they can die anytime, they can collapse, they can have an attack, they can have stroke, and they can blame it on people in the village. So it's important to follow my trend. Now, in maternal health, hypertension is very important in so many ramifications. It's a medical condition that leads to increase in the pressure of the blood in your arteries. Now, when the increase in pressure persists, you will develop high blood pressure. This condition is termed deadly silent killer because some people will not have any symptoms. Now, on the long term, high blood pressure can put you to risk of developing heart diseases, especially what we call coronary artery diseases. You can also have heart failure. You can also have peripheral vascular disease. You can have loss of your vision. You can have kidney failure. You can have stroke. So anyone that develops hypertension can have any of these complications. Hypertension can also affect pregnant women. When you develop hypertension in your pregnancy, it's termed pregnancy-induced hypertension. It can complicate that pregnancy. It can lead to preeclampsia. You can actually die from it, or it can affect the outcome of your pregnancy. It can affect the development of your baby. So hypertension on the whole is very important. Now, when you don't control your hypertension, uncontrolled hypertension can lead to stroke by damaging and weakening the blood vessels in your brain, ultimately rupturing and causing a lot of problems. High blood pressure can also lead to blood clot in the arteries, leading to brain damage, leading to stroke. So there are so many pathways you can have problems when you have high blood pressure, which is not diagnosed, which is not controlled, which is not treated. Now, unfortunately, when you develop high blood pressure, there is no permanent cure. We can manage it. You can be off drugs. You can sustain your blood pressure by your lifestyle, but it's not permanently treated. It's important to understand this. This is the reason why it's so important to focus on prevention, because if we can prevent hypertension from developing, then we will not have any need to treat it. And unfortunately, it's not permanently treatable. So high blood pressure can harden your arteries, decrease the blood supply back to your heart, and cause a lot of problems: heart attack, heart failure, congestive heart failure. Now, some people that have high blood pressure can actually notice what we call chest pain. Medical practice, we call it angina. Angina. So some people can present with just, chest pain. This might be the only sign you might actually have high blood pressure. Some people can have heart failure. In heart failure, your heart can no longer pump blood, And when your heart can't pump blood, you don't get oxygen. And when you don't get oxygen, your organs will begin to fail. Some people can have heart attack. When you have heart attack, it means that the blood supply to your heart is blocked. So the muscles of your heart will die and you will not get enough oxygen. The longer the blood flow in your blood vessels and your heart is delayed, the more it will damage your organs. Some people will also develop diabetes. Some people will also develop complications that follow high blood pressure, including kidney damage, including kidney failure, leading to complete shutdown of your kidneys, having renal failure, and affecting everything about you. So let's talk about the strategies. Now we know all these things. How can we prevent prehypertension? There are so many people that are prehypertensive right now. I'm not going to focus more on the numbers you will get, but I'm just going to make a blanket statement. If you have checked your blood pressure at least 4 different times and you are getting reading above 140/90, the upper number is called the systolic. The lower number is called the diastolic. If you have checked your blood pressure at 3 different times in 2022 and you have consistently had a blood pressure of 140/90, my sister, my brother, it's possible you have hypertension. You must go to a doctor who will help you to figure things out. Now, while you're doing this, you might actually be in the category of prehypertension. You have not fully graduated to hypertension. So what I'm going to discuss with you now are the things you can do to make sure you don't develop full-blown hypertension. Number one, unfortunately, our body weight correlates with developing hypertension. So if your body weight, admin please, if you wouldn't mind, please share the formula for BMI. When you plug your body weight and your height and the outcome, which is called your body mass index, if your BMI, which is called body mass index, is actually a criteria we use in knowing if you're overweight, if you're underweight, if you have obesity. If you plug your number in and your number is now hovering around 18.5 to 24.9, that's the safe range. We want everybody in our community to be within 18.5 to 24.9. This is the healthy body range for your BMI. Now, if your BMI is above 25 and it's below 30, you are considered overweight. If your BMI is above 30, we have a problem. You have obesity. This is actually where the major problem is. So people that have weight problems can easily develop full-blown hypertension. So it's possible you're currently struggling with your body weight and you also want to have a baby. And I know some people will quickly want to go and have a baby. It's not advisable to have increase in your body mass index, increase in probability of developing hypertension, increase in probability of developing diabetes, and you want to start your family. You have a lot of complications. So number one practical way of preventing development of full-blown hypertension is to do what? Work on the excessive body weight you have. Modify what you do so you can lose that body weight. So by default, I'm telling you to make sure that your BMI is within 18.5 to 24.9. So long as you're within this range and you are in the prehypertensive stage, you can actually stay there for long or you can actually resolve by itself. But when you begin to sustain your BMI, if your BMI begins to be sustainably high, above 25, some people are above 30, then you might likely develop full-blown hypertension, which has a lot of complications. So number one, work on your body weight. Now, number two is also related to number one. You have to exercise regularly. We notice that people that exercise regularly will over time have very healthy body weight, will over time avoid development of diabetes, will over time avoid development of other complications in the body. When you exercise doesn't necessarily mean you need to go to the gym and you live there. There are so many things you can do at home and you exercise. And you can dance, you can swim, you can do treadmill, you can run, you can walk, you can do domestic chores, you can climb your staircase. they are exercise. If you can do this daily, you are getting your exercise at least 30 minutes in a day. So if you can exercise moderately daily, you are preventing yourself from developing full-blown hypertension. Number three, what we eat. We over time become what we eat. If you can eat right, so by eating right, it means you still have to eat food from the major 5 classes of food. There is no food you should avoid, but you eat the right food at the right time, at the right quantity. So you eat a lot of fruits, you eat a lot of vegetables, you eat a lot of whole grains, you eat a lot of safe fish. There are some fishes you are not supposed to eat. So eat a lot of fruits, vegetables, whole grains, fish, and finally low-fat dairy products. So that means if you want to go buy your milk, look out for low-fat milk. It helps. So if you can eat right, if you can exercise, if you can watch your body weight, even when you are given prehypertensive diagnosis, you can stop it right there and prevent developing full-blown hypertension, which is very, very deadly. Now, number four, you have to cut down on your dietary salt intake. Dietary salt is part of the reason why some people will eventually develop full-blown high blood pressure. Why? Because your dietary salt contains what we call sodium chloride. And sodium chloride retains a lot of water. And when we have a lot of water in our body, there will be a lot of burden on the heart, and you can easily develop high blood pressure. So you have to make meticulous efforts to reduce your consumption of dietary salt. Dietary salt, especially if it's non-iodized, especially if it's raw salt, compared to the salt you use in cooking. When you sprinkle salt to your food because it's not to your taste, you are actually causing a lot of harm. Avoid that. Cut down on your dietary salt intake. Very, very important. Number five, eat food low in saturated and trans fats and cholesterol. Cholesterol and food that have high fats can easily clog and block your blood vessel. And when it blocks your blood vessel, it's going to harden your blood vessel. Your blood vessel will have a lot of resistance. Your heart will not function the way it's meant to function, and you develop hypertension. So when you want to eat, consider food that have low saturated and trans fats and cholesterol. There are some good cholesterol, there are some bad cholesterol. The bad cholesterol is the low density lipoprotein. The good cholesterol is the high density lipoprotein. Every woman in this community, any man in this community who is exercising regularly, who is fit, will have a higher ratio of high density lipoprotein compared to low density lipoprotein. When you have a higher quantity of low density hypoprotein, you are predisposing yourself to developing a lot of medical problems. So the idea is to have more HDL, high density lipoprotein, compared to low density lipoprotein. Very, very important. Now, finally, concentrate on your plant-based food. Anytime you are eating and you have an opportunity, embrace your plant-based food in lieu of animal-based food. So in a nutshell, these are the six. Actually added, I think I added an extra 2 points. So these are the 7 things you can do. And by the special grace of God, despite the fact you were given a diagnosis of prehypertension, you can prevent yourself from developing full-blown hypertension. Now, please listen to me carefully. If you're planning to become pregnant, please go for your preconception visit. When you go for your preconception visit, we are going to check your baseline blood pressure. If you personally come to me and I discover you have prehypertension, I will first of all want you to work on that before becoming pregnant. The problem is, if you have undiagnosed high blood pressure, or if you have poorly treated high blood pressure, when you become pregnant, the state of pregnancy will make your high blood pressure worse, especially in retaining water. So if you notice, pregnant women retain a lot of water. That water you're going to retain is going to further increase your blood pressure, which will further lead to complications in your pregnancy. There is a major complication in pregnancy we call preeclampsia, a combination of increase in your blood pressure, generalized body swelling, and seeing protein in your urine. You cannot afford to want to be a pregnant woman and become a mother, and you have not worked on your blood pressure. It's very important. So at this juncture, I'm going to allow the clinic to start asking questions. So we have at least 15 minutes. Please feel free and ask your questions in real time. Immediately after this clinic, I'm going to go straight to our Facebook, and we have another 30 minutes opportunity. Please ask your questions. The clinic is actually fully loaded. I can see COO, I can see Chinyere, I can see Onyinye, then I can see our amazing Tosin, amazing lady. Guys, please start asking your questions. Now, like I mentioned, majority of people will have no symptoms of high blood pressure. Majority of you will not even have any singular symptoms. However, some women will notice chest pain. Some women will notice persistent headache. Some women will notice dizziness. Some women might notice insomnia. These are non-specific symptoms, but there is no one standard high blood pressure symptoms. Majority will not have any symptoms and their blood pressure is very high. But if you notice any of the ones I've mentioned, please ring your doctor. But in the interim, even if you don't have prehypertension, every single 7 points I gave you, they are the things you should be doing every day. You should by default watch your body weight. You should by default exercise. You should by default sleep. You should by default mind what you eat. You should by default be very mindful of what you think about. Stress can also complicate your development of hypertension. So please, generally, think about things that will relax you. Okay? What hormone helps lower blood pressure? Now, there are so many hormones that play a role in stabilization of high blood pressure. I'm just going to limit it to the simple ones. Angiotensin converting enzyme. I'm not going to make it, too big, but there are so many hormones which by default can affect your blood pressure. Angiotensin is number one, even your insulin, to an extent, even your cortisol. So your stress hormone and even the insulin that controls the movement of and handling of the sugar in your blood, they can affect the handling of your blood pressure. But I'm not going to bother you about the academics. There are so many other hormones, but take note of these ones I've mentioned. Okay? Good afternoon. Okay, so let's see. Afternoon, doctor. Is there any danger of someone high pulse rate? Yes. When you have consistent high pulse rate, it might be an indication that you might have quiescent or dull or undiagnosed high blood pressure. So you have to go and meet up with your doctor. High pulse rate means when you check the difference between the upper range and the lower range, the difference will give you high pulse rate. Okay? So yes, follow up with your doctor. It's not normal. Can female hormone imbalance cause high blood pressure? No. However, high blood pressure and hormonal imbalance cannot intermingle, but hormonal imbalance as a separate entity do not lead to high blood pressure. But women that have hormonal imbalance can develop high blood pressure. So by default, hormonal imbalance is a risk factor to developing high blood pressure, and high blood pressure might be a risk factor to developing hormonal imbalance. And what happens when you develop hormonal imbalance? You are not likely going to ovulate. And what happens when you don't ovulate? You will have infertility. And what happens when you have infertility? You will not be able to have your babies. Very, very technical question from Onyinye. Tough question, but too deep. So I'm gonna keep it very simple, okay? Okay, so here we go. Are there any medications that may cause increase in blood pressure? Yes. There are some medications, especially medications you abuse by yourself, street drugs, recreational drugs, herbs, sleeping pills, There are so many medications out there that will inadvertently, because you're taking them, affect development of high blood pressure. Top on the list is recreational drugs. So all those drugs you abuse to get high, to feel this, to feel that, they will predispose you to developing full-blown hypertension, including some lifestyle like smoking and drinking alcohol. So imagine if you don't exercise, if you don't sleep, if you don't eat good food, and on top of that, you're smoking and you're drinking alcohol, what will happen? You are knocking on the door of hypertension to please quickly come. Then maybe your two parents are hypertensive. Then you're just getting ready to vacate this world before your time is up. So yes, kind of beautiful question. Yes, there are some drugs implicated in direct development of high blood pressure. How often should one check for hypertension? Well, it depends on your history. Here's what I will tell you. I wouldn't mind you check it every 3 months. But if you are hypertensive, or if you have high blood pressure, or if you're pre-hypertensive, definitely check it monthly. So it depends on your status. If you have a familiar history of hypertension, definitely I will want you to check every month. If you are already hypertensive, at least check few times in a month. So it depends on your current status. If you don't have any of the risk factors, then you can check at least 3 times in the year. But if you have any predisposition, like for all women that have contact with the hospital, for all pregnant women, anytime you come for your ANC, we must check your blood pressure. Okay, very, very important, because hypertension can complicate your pregnancy in so many ways. All right, can lack of estrogen cause high blood pressure? No. Lack of estrogen, and when you mean lack of estrogen, it means that your estrogen is reduced. It's part of the hormonal imbalance package, which can be a risk factor, and hypertension can also lead to this. Estrogen is actually a hormone that can play a lot of role in women, especially when they are getting older. So the answer is yes and no. Okay? All right. What birth defects are caused by high blood pressure? Now, what we have to understand is when your baby is developing, there are 4 chambers in the heart. Unfortunately, some babies will have what we call congenital heart abnormality. So some babies might have problems with the left side of the heart, right side of the heart. Some parts might not develop. Some parts might be communicating not the proper way. When that happens, that child already came into this world with heart defect. So our aim is to correct that heart defect, because if the chambers in the heart are not distributing and collecting the blood the way we want it, then that child is going to develop hypertension. Now, if the mother of that baby is predisposed to smoking, drinking alcohol, using recreational drugs, then the possibility that that particular trait can also lead to abnormality in the developing baby is very high. So the lifestyle of the woman who has the baby can play a role in the development of congenital anomaly in the baby. There are even some women that won't do anything and their babies will still have more problems. How much more when your lifestyle is more like you're knocking on the door of hypertension to develop? Can pregnancy trigger hypertension? Yes. In some women, they can develop pregnancy-induced hypertension, PIH, which can predispose them to preeclampsia, which is a complication of pregnancy. This is the reason why all pregnant women must keep an eye on their hypertension. Now, the good thing about this pregnancy-induced hypertension, when your pregnancy is over, your blood pressure will come back to normal. But here's the deal. There are some women, unfortunately, because of some lifestyle changes and because of a couple of things they're not doing, they will develop full-blown hypertension after pregnancy. But generally, women that have pregnancy-induced hypertension, when your pregnancy is over, your blood pressure will come back to normal. Unfortunately, the state of pregnancy can change a lot of things in our body. There are some women that will develop what we call gestational diabetes. So the type of diabetes you will develop when you're pregnant, then once you have your baby, you will feel better. The state of pregnancy is really a multi-complex thing. It can change a lot of things for good and better in our body. Okay, keep asking your questions. We still have about 6 minutes. Ask your question. This is I cannot overemphasize the importance of this particular topic. So many people are taking time bomb out there. I think there was one clinic I was running and a lady told me she had 150 over 100. Now, you don't want to have those numbers and you're still at home. You have to ring your doctor and go to the hospital immediately. If you notice this persistent dragging, it looks like you're seeing double vision kind of headache, go to the hospital. Possibility is that you have what we call malignant hypertension. Malignant hypertension means when we are checking your blood pressure, we are getting a neighborhood of 200 over 150. You are a ticking time bomb. You can actually collapse. You can die any moment. And it's not people in the village. And it can happen to the best of us. It can happen to doctors. It can happen to nurses. It can happen to the president. It can happen to anybody. Unfortunately, we don't know what leads to hypertension. No one knows the exact cause of hypertension, but we know the risk factors. But there is no known cause of hypertension. It will surprise you that in medical practice, there are so many things we don't know, right? But true. When we don't know, we don't know. And we don't claim to know. Okay? At what age, any baby, any youth, any adult can develop hypertension, but it's commonly seen among adults. But anybody at any age can develop hypertension. Okay? All right. All right. What should you avoid with high blood pressure during pregnancy? Pretty much everything I mentioned. You have to watch your body weight. You have to avoid stress. You have to drink a lot of water. You have to avoid smoking. You have to avoid alcohol. You have to eat right. You have to sleep. Anything that will relax you is what you do. So pretty much all the tips I gave you about preventing development of prehypertension to hypertension is what you practice when you're pregnant. Very important. You have to exercise. You have to sleep. You have to avoid stress, especially if you have a family history of hypertension. Okay? All right, guys. Do you still have any questions? Remember, if today is the first day attending my clinic, my weekend clinic comes up very early, 5 p.m. Nigerian time, 12 p.m. Eastern time. Now, from tomorrow, we have a difference in timing. So all the people in America will fall back. So for our clinics, starting from tomorrow, our clinics will now be by 12 p.m. Eastern time, US, 6 p.m. Nigerian time. So it will no longer be 5 p.m. Nigerian time. It's now going to be 6 p.m. Nigerian time. And this is the time of the year we normally love because Dr. Ndiche's clinic will harmonize with my clinic. Previously, Dr. Ndiche's clinic is 6 p.m. Nigerian time, 1 p.m. US time. But now it's going to be uniform. 12 p.m. Eastern time US and 6 p.m. Nigerian time. Starting from tomorrow, we are falling back. We are going to lose 1 hour. So all the people in America should take note of this. And all the people, especially in Nigeria, should take note of this. It's no longer going to be 5 p.m. It's going to be 6 p.m. Yes. COO asked a very important question. Yes, hypertension is familiar. Hypertension is hereditary, especially the other way around. So what do I mean? If your dad is hypertensive, the possibility that all the daughters in that family will have hypertension predisposition is very high. If your mom is hypertensive, the possibility that the sons might likely predispose themselves to developing hypertension is very high. Now, imagine when you have a family history of hypertension and your lifestyle is not in tandem with health, what will happen? You will develop hypertension faster. Now, some people can overcome the genetic component of developing hypertension by changing their lifestyle. So your two parents can actually be hypertensive, but when you come into this world and you begin to exercise, you begin to eat good food, you begin to avoid stress, you don't smoke, you don't drink alcohol, then you can flip your genetic predisposition to hypertension because you're living a healthy lifestyle. So your salvation is in your hands, actually. So the answer is yes. We have 1 more minute to end the clinic. Remember, immediately after this clinic, I'm going to run another clinic in our Facebook page and our Facebook group. So please make sure you join me immediately after this. And I think we've come to the end of the clinic. I don't think I have any other question remaining. Okay, here we go. Okay. Solomon Obodo, you joined us, but you didn't ask any question. Please follow COO She posted the formula for BMI. Make sure you know about your BMI. Very, very important. How can you calculate your BMI? Plug your weight on top. Divide by your height, meters squared. So let me give you an example. If your body weight is 150 and your height is 5 meters, your BMI is 150 over 5 times 5. When you get your number, make sure your number falls between 18.5 to 24.9. If your number is above 30, you have a problem. You have obesity. Obesity is not good. Obesity will cause a lot of problems. Okay, guys, my time is up. Thank you for coming. I'll see you guys in Facebook. Until I see you, remember, God loves you and keep on keeping on. Bye-bye for now.